Hello everyone, welcome back to another episode. So today I'm going to be talking about breastfeeding and the benefits of breastfeeding to the baby and the mother. The benefits are so overreaching and so vast that I won't be able to cover each and every one of them, but I will go into some of them. So the World Health Organization, the WHO, has put out there's the 10 steps to effective breastfeeding. So they have hospital policies, they have staff competency, antenatal care, care right after birth, so breastfeeding within 30 minutes. They have that you are helped to breastfeed as well, encouraging skin-to-skin contact, the kangaroo mother care, and helping mothers to put their babies on the breast immediately. Then also antenatal care, so preparing women on how to feed the baby. Also with a man, they should have the husband there as well, that he can also help and facilitate. So helping with foods that can benefit breastfeeding, that can help stimulate breastfeeding and lactation. Rooming in together with the baby to improve bonding and to improve blood flow and milk flow. So supporting mothers with breastfeeding, with support groups, checking attachments, helping with some common problems, mastitis, helping with responsive feeding. So baby-led weaning, baby-led weaning, so that the baby helps to guide the process of breastfeeding. So helping mothers know when the baby is hungry, not limiting feeding times, for example. And then helping with the discharge as well. So this is what the WHO has put in place. They call it the 10 steps to successful breastfeeding. Then there are others as well, that you can make the decision to breastfeed, that there are many different benefits to breastfeeding. So it helps with bonding, it helps to reduce disease risks, a vast array of disease risks for both the mother and the child. It is a factor in child health, in later health, in dental health, in bone health, mental health. So there's an overreaching health impact with breastfeeding on the baby. So that is just with breastfeeding. So continued breastfeeding, which the WHO recommends up to 2 years, 2 years of breastfeeding, is beneficial to both the mother and the baby. So first of all, to the mother, it releases oxytocin, which helps uterine contraction and helps the uterus to go back into its position and help to get rid of the blood that's there, so to decrease the occurrence of hemorrhage. And it can help to increase your pain threshold, reducing the maternal discomfort, and then contributing to increased feeling of love for the baby. So instead of focusing on the pain, you're focusing on the baby. So it helps to take away your menstrual flow as well. So it helps regulate the progesterone and the estrogen, so it increases your progesterone levels. So it can protect against pregnancy, which can be 96% effective within the first 6 months. So that is with increasing your progesterone levels and decreasing your estrogen levels. So it makes you infertile. So it's not 100%, the article says about 96%. So it also helps with weight and body image. So it helps you to lose weight because the baby is drinking and taking a lot of your nutrition, and it gets you back to your pre-birth weight and condition. It also helps with it reduces your risk of breast, ovarian, and endometrial cancer, diabetes, osteoporosis, high blood pressure, cardiovascular disease, metabolic disease, rheumatoid arthritis, Alzheimer's, and multiple sclerosis. So it decreases your risk for all of these diseases if you're breastfeeding. So this is to the mother, but it's also to the baby. So it also reduces the risk of bleeding, infection. It reduces adiposity and weight gain in the mother. reduces the risk of postpartum depression, it reduces stress and anxiety. So there are many things that it can help breastfeeding. So the benefits really outweigh the negatives. So it might be a little uncomfortable at first, but you get used to it. There are things that you can ask the nurses or your lactation specialist or your dietitian or your speech therapist. They can all help you with latching, with attachment, with different positions, how to hold the baby. If you have a high flow or a slow flow, if you have very strong flow, what positions can help, what attachments can help, how to hold. So different ways of positioning the baby, sitting, standing, lying down, with pillows, with cushions. All of these things can help. And you can also express your breast milk and then give in a bottle as well. So that's another way that you can still get the benefits into your baby without physically having to breastfeed. So it leads to stronger bones, stronger teeth, stronger immune system, because you're passing your immunity to your child as well. So better and a stronger immune system. It helps with brain health. It helps reduce the risk of any non-communicable disease like diabetes, obesity, heart disease, liver disease, diabetes. All of these the risk is extremely reduced. With cancers as well, the risk is reduced. So there are so many positives when it comes to breastfeeding. There really are a very limited amount of negatives. So I encourage everyone to try and breastfeed if you can. So breastfeeding really helps to determine a healthy infant. The breast milk is specific for your baby. Each woman's breast milk will be different, and that is specifically for your child. So it's also associated with a reduced risk in childhood infections for the baby, necrotizing enterocolitis, reduced risk, and reduced risk for SIDS, sudden infant death syndrome. So this is for the baby. So it has a positive impact on society and the ecosystem as well, because you are not using a lot of things that can cause pollution, and it's also cheap because it's just coming from you. So there are many different factors that can influence breastfeeding. There are many positives for the mother as well as for the baby, as I've said, and the benefits carry on long term. So if you think of the attachment in the first while, that attachment and that bond between the mother and the baby, that will continue over a long term. And if that can be established at the start, that will then increase later on as well. So that will lead to better bond in, for example, the teenage years as well. So there are many benefits even later in life that you might not think about right now too. So there's this mother-child bond, there's the impact on health, there's the impact on the family as a whole too. It helps the family come together as well. So it helps with body image of both the child and the mother, because with breastfed babies usually have better and more balanced growth, if I can put it that way. They don't often go too big or too small. A lot of bottle-fed babies can have adiposity, or they are a little too big. They have rapid weight gain. So it's really important for women to breastfeed. It has many benefits and varied benefits for both the mother and the child. And if you can initiate it within 30 minutes to 1 hour of birth, then the benefits will really outweigh the negatives, and it can serve as a bonding time, a healing time, and it can help you over the long term as well, both the mother's health and the child's health, because it protects against cancers and non-communicable disease, which are long-term diseases. So I hope this video has been informative. Breastfeeding is wonderful. Breast is best. There are a limited amount of factors where you are not able to breastfeed. It's a very, very limited list of things. So if you can breastfeed, I really encourage you to try to do it. Even if you have to express and then give it to your child in a bottle, it's better than going with an alternative like cow's milk or goat's milk or soy. The mother's milk is really specific for that child. It passes immunity, it passes nutrition, it passes all the beneficial compounds to the child. So I would encourage you to rather breastfeed. It's also a cheap option, it's an easy option, it's always there. When your child is sick, you then can breastfeed and you will help to heal your child. So you will be the healer for that child. It's also the most effective method of bringing down a fever in a child is breastfeeding. You pass your cells onto the child that will help bring down that fever. So it's really a wonderful disease fighter as well. So as always, stay healthy. I hope this has been informative and that you've enjoyed the content. To God be the glory.